communities, access to basic water and sanitation facilities can mean the difference between health and disease. Ebola, a deadly virus, spreads rapidly through poor sanitation and unsafe practices. The Ministry of Health announced an outbreak of Sudan Ebola virus in Uganda on 30th January 2025. Among other areas, Kyegegwa District was identified as one of the high-risk areas. In response, Oxfam developed an Ebola response plan in alignment with the Ministry of Health. Oxfam's intervention complemented existing initiatives by leveraging its expertise in risk communication and community engagement, safe water supply system construction, and infection prevention and control in refugee settlements and host communities in Kyegegwa District. We enhanced the effectiveness of district, national, and partner-led initiatives to ensure a holistic, efficient, and impactful response that minimized the spread of Ebola and protected over 49,000 refugee and host populations. At the center of this effort were community volunteers such as village health teams who were trained in EVD surveillance to conduct active case finding, contact tracing, and follow-up, ensuring everyone understands how to stay safe.
Niko VHTs kutoka zone ya Bukere. Natumika kuma outpost, nasaidiana na health center 4 ya Bujuguli. Hospitali outpost tunatumika na wa VHTs tuko wengi, sio mimi peke, lakini nasimama kwa niaba ya wa VHT wale. Oxfam ilitufundisha wa VHTs wakati ya magonjwa ya Ebola, lakini wao walitufundisha au walitutrain tuko wa VHTs 100. Walitufundisha kuhusu Ebola, namna dalili zake na alama zake. Tuliona kwanza sisi wenyewe wa VHT kuona gizi ya kujikinga kabla ya kwenda fundisha wengine. Tunavaa ma gloves, tunakuwa na mask, na tunakuwa na sanitizer. Na wakati tunaenda mkazi, tunajua namna ya kujikinga tusisogelee wale watu kukua karibu yetu. Tunakuwa kama mita 2, tunafundisha wakahaji wetu kujua namna ya kujikinga, kunawa mikono na sabuni. Watoto wasiende cheza mbali na nyumba zao, kukua fasi moja na kuacha kuenda fasi ya kukusanyiko watu wengi.
VHTs plays a great role in the health system. In Uganda, VHTs act like Health Center 1. VHTs is a source of information. Now, if the case is called, let's say, Ebola, for example, it is the VHTs that we use for contact tracing because they know their people very well and they help a lot in sensitization. During the outbreak, Oxfam facilitated a lot because the population served as Bujuguli Health Center 4. We are serving around 2,000 to 3,000 patients per day, and in our isolation we have a 16-bed capacity that need wash services, water, soap, liquid soap, things basically for hygiene. At the beginning of the outbreak, we faced a lot of challenges managing the outbreak because patient has to go out to look for water, patient has to go out to look for what to use for washing their hands. But the presence of Oxfam and their support they rendered to Bujuguli Health Center 4 during the outbreak facilitated mostly the health workers and the patients that were admitted at the isolation.
Oxfam has created a very big impact and a very positive attribution towards the outbreak response. They have really helped us on the distribution of the wash facilities, whereby they have distributed tanks that can help us sustain water, especially in water cut-off times when it is very sensitive for us, that you can't run in the ETU, in the Ebola unit, without water, and which is very crucial in infection and prevention method.
Kwa muda huu tuko hapa kwa masomo, japo watoto walishapumzika, hawako kwa shule. Nafika kuwaonesha gisi, tunawafundisha wakati masomo iko na watoto wanasoma.
The installation of the tank from Oxfam helped the school to fight Ebola, more especially providing water in the hand washing facilities, and it has also helped learners, more especially menstrual hygiene for the girls, because most of the time they didn't have water and it was so risky. This water actually is being used by over 3,000 learners in the school. Maintaining the water sources, we opted giving skills to the learners to make sure that they maintain that water by giving them time when to open the facility and when to close it on a daily basis.
Mai iko kitu ya kwanza kwa maisha ya mtu. Nahitaji sasa mai njoo isha kuwa. Si ndio? Mai iko hapa tayari, nahitaji nini sasa? Nisinjo kuweka ulinzi ya mai yetu mzuri.
Tunashukuru Oxfam kwa kutusaidia kwa mbio mbio, kutusaidia na mai. Tulifanya usafi ya kuendea kunyumba ilikuwa natushinda juu ya maji mbali. Tunapata gizi ya kujisaidia kwa usafi mbio mbio na kukinga Ebola.
Hii usafi ya maji VST wamenifundisha, walimu na wazazi. Wakati tunaenda shule, maji natusaidia kukunywa na kunawa mikono. Wakati tunarudi nyumbani, mai natusaidia kunawa mikono, kusukula masani, kufula uniform, na wakati tunatoka kwa choo, tunanawa mikono.
Tulifanya training na Oxfam. Kulikuwa shida ya magonjwa ya Ebola, na ile vitu walitufundisha alama za Ebola, na ile mafundisho kwa kweli ilitusaidia sababu tulipeleka kwa wakaji. Challenge zenye tuko nazo sawa vile wa VHT, mara nyingi tunaenda kufanya home visit, unakutana tunakosa vifaa ya kazi, tunakosa hata transport, unakutana hatuna vifaa ya kutumikisha. Sa vile raincoat, tunakosa umbrella, tunakosa mabaga juu unaweza kuwa huko kwa field kule ulienda fanya home visit na mvuli inanyesha. Uko na mabitabu, ile mabitabu zinaweza zikalowana kule kwa field sababu hauna vitu vya kujichunga.
To ensure sustainability, Oxfam worked with the different stakeholders, that is the district, OPM, and the different implementing partners. And after construction, these facilities have been handed over for management of the district, OPM, and the different implementing partners for health and WASH.
A vital role in partnering with organizations like Oxfam is to support the districts and the country at large in implementing preventive or related activities so that we are able to prevent some of these outbreaks.